Sexually transmitted diseases, patient diagnosis and management. Interview questions. It is important to ask the patient the following questions. Is your pain worse at the start or the end of urination? How severe is your pain with urination? When did your pain with urination start? Do you have any blood in your urine? What are the events surrounding the start of your pain with urination? Do you have any genital sores or discharge? When did your last period begin? Clinical findings. Clinical findings are an increase in urinary frequency, vaginal discharge, cervical friability, heavier periods, spotting, pain during sexual intercourse, fever, and pain in the lower abdomen. Additional findings might also include a sore throat and dysuria. Diagnostic studies. The three approaches to laboratory testing for diagnosing gonorrhea include microscopy, bacterial culture, and NAAT. Microscopy provides high sensitivity and specificity, but only for men, and is not recommended for women. Bacterial culture should be viewed as a more suitable diagnostic study since it has a test specificity of more than 99%. It is the most accurate testing method among the suggested ones. Nucleic acid amplification testing, or NAAT, is also a highly specific method of testing, although it is slightly less accurate than bacterial culture, and can sometimes lead to false positive results. Genitourinary exams, external, vaginal, speculum, including vaginal pH, bimanual exams, evaluation of vaginal mucosa for inflammation, examination of the cervix, and evaluation of pH of the vaginal discharge are also necessary to provide the right diagnosis. Primary and differential diagnoses. The differential diagnoses include bacterial vaginosis, Candida vaginitis, and genital herpes. The primary diagnosis is cervicitis. Bacterial vaginosis has symptoms similar to the ones described by the patient and observed by the clinician, vaginal discharge that might have a bad odor or be grayish or yellow. However, bacterial vaginosis does not usually lead to painful urination and increased urinary frequency. Candida vaginitis can have the following symptoms: burning, irritation, dyspareunia, as well as erythema or edema. However, thick and white vaginal discharge on the vaginal walls is also common for this condition, which was not observed in the patient. Genital herpes is a sexually transmitted infection that has the following symptoms: blisters and ulcers in the genital area, itching and burning. Body aches and fever can also be observed in some cases. Despite some similarities in symptoms, no ulcers in the genital area were noticed. Cervicitis is the infection of the lower end of the uterus that can be caused by different factors, including sexually transmitted diseases, allergies, or bacterial imbalance. However, due to the patient's recent unprotected sex, specific symptoms such as vaginal discharge, dysuria, and increased urinary frequency, gonococcal cervicitis is assumed to be the primary diagnosis. Management plan. Pharmacotherapy for this patient includes ceftriaxone 250 mg intramuscularly 1 dose and azithromycin 1000 mg orally 1 dose. Gonorrheal infection shows resistance to previous generations of antibiotics, whereas ceftriaxone is recommended as an effective treatment for it. Additionally, the clinician can prescribe azithromycin 1000 mg orally 1 dose, which is used for the treatment of both ceftriaxone-resistant gonorrhea and presumed concurrent chlamydia infection. If ceftriaxone is proven to be ineffective for this patient, azithromycin is a suitable choice. The patient will need to be educated about the treatment of recent sexual partners, receive additional information about the influence of barrier protection on the risk of having STDs, as well as a referral to HIV, hepatitis B, syphilis screening, and HPV vaccination. HPV vaccination is specifically recommended because the patient is 25 years old, and the vaccination's effectiveness still can be high, thus preventing the patient from the risk of developing HPV-associated cervical cancer. Additional counseling about abstinence from sexual intercourse until the end of the treatment is needed too.